Ever wondered why you should never ever use a silicone rubber dam when removing amalgam fillings? Stick around because I'm about to reveal some crucial steps that every dental professional should follow. Plus, I've got a step-by-step checklist developed with Dr. Dietrich Klinghardt at the Swiss Biohealth Clinic in Switzerland at the end of this video. As a dental professional, you handle one of the most toxic elements on the planet daily. Safety and routine often go hand in hand. I mean, picture this, just like a pilot meticulously goes through a pre-flight checklist, even though they know every button in the cockpit, you too must adhere to strict protocols. Without these protocols, there is a risk of negligence, especially when it comes to hidden dangers like removing amalgam fillings. For years, we were told that amalgam fillings were perfectly safe. But think about it, something made of 50% of one of the most toxic elements can't be harmless, right? It is easy to downplay the dangers of amalgam because we've been conditioned to believe it's not that bad. But don't let these misconceptions fool you. When it comes to removing amalgam fillings, using a rubber dam is a good start. But there is more to consider. A rubber dam only prevents larger particles from being swallowed. The real danger lies in the mercury vapor released during the removal process. Mercury vapor is produced through chewing, grinding, and temperature changes, and it becomes especially potent when we drill into amalgam fillings, creating friction and heat. So why is mercury vapor so dangerous? When inhaled, it's quickly absorbed into the lungs and crosses the blood-brain barrier, entering the central nervous system. This can cause severe harm over time, and it's nearly impossible to detox using standard protocols. Mercury can stay in the brain for decades, leading to issues like tremors, memory disturbances, cognitive dysfunction, and motor impairment. So why not use a silicone rubber dam? Well, silicon is highly permeable to vapors, which makes it useless for blocking mercury vapor. So it's important to use a non-silicone rubber dam. To ensure the safety of everyone in the room, you need to follow these additional measures, which were developed at the Swiss Biohealth Clinic with Dr. Dietrich Klinghardt. You can download the full checklist using the link in the description box below this video. Number 1 is use a non-silicone rubber dam and ensure it's properly adapted around the tooth. Seal it with a liquid rubber dam barrier material to prevent any leaks. Number 2. Minimize heat production. Use a fresh cutting instrument specifically designed for amalgam removal. This reduces the friction and the vaporization. Number 3. Avoid pulverizing the filling. Cut the amalgam into large chunks rather than pulverizing it. It reduces heat and vapor production. Some advocate cutting around the filling instead of through it, but this can lead to other issues like removing too much healthy tooth structure, so I'm not a big fan of that. Number 4. Use a clean-up evacuator. This system creates a strong suction around the tooth, capturing most particles and vapor. Number 5. Employ an air filtration system. Systems like the IQ Air create an airstream that directs the vapor into a HEPA filter, ensuring all mercury vapor is captured. And number 6. Wear protective masks. Use masks with a gold layer, as mercury has a high affinity to gold. This helps capture any remaining mercury vapor, protecting your lungs and your brain. Some recommend providing oxygen through a nasal tube, but this can potentially open the blood-brain barrier more, increasing the risk, so therefore I don't recommend this step. This might seem like overkill, but think of it as a multi-layer safety net. If one measure fails, others will still protect you and your patient. For extra precaution, you can even use chlorella or medical charcoal paste in the cavity, and then wait for 30 to 60 seconds and then rinse. While this is not proven by any studies, it doesn't harm and it might help. If you are a dental professional, I hope this video helps you to optimize your amalgam removal protocol. Download the free guide with all these steps from the link in the description box. And if you are a patient wanting to know more about safe amalgam removal, the guide is for you too, of course. And have you had amalgam fillings removed already? Then share your experience in the comments below. Whether you are a dentist or not, please share this video to spread awareness about safe amalgam removal. And always remember, if we can do better, we should do better.